Hi, my name is Dr. Ross Hauser. Welcome to Caring Medical Florida in beautiful Southwest Florida. I'm just going to review an article that I wrote in 2013 with Dr. Feister, DO. This was published in the Journal of Prolotherapy, like I said, in 2013. Prolotherapy works really good for fingers and thumb. The thumb joint is what gets most of the force with grip. The most common pain that we treat with prolotherapy in the hand is the base of the thumb. So the base of the thumb right there. And we did a study that was data from the charity clinic that involved 17 thumbs basically. Now, thumb, finger, wrist instability can cause all kind of things such as carpal tunnel syndrome or median nerve irritation, triangular fibrocartilage complex tear, that would be here. When someone has a fracture, it injures the ligament, so post-fracture pain is mostly finger, wrist, or hand instability. Heberdines and Bouchard nodules, that's from, in my opinion, instability, and we can show instability in the thumb or the finger by ultrasound. So we actually move the joint, and under ultrasound you can see the joint go apart, so that's a sign that you have joint instability. I can shake people's hands like in church. I can shake people's hands and I know that they have wrist, finger, or thumb instability just because I'm so sensitive, because I've examined so many joints. So this is called a grind test, so anybody can do that, and if you feel clicking, popping, grinding, that's a sign of instability. And then this was from the study, and you could see that there was significant pain relief, especially pain while exercising. So it went from a scale of 0 to 10, 10's the worst pain. It went from a 7 to a 2.8. Stiffness went down, range of motion improved, and crunching sounds went down. In the charity clinic, it was just dextrose prolotherapy. There are times that we use platelet-rich plasma when there's a lot of arthritis, and then you're doing the joint comprehensively. So why don't we just see a treatment? Then this is interesting because you're going to see it's under x-ray. I just did this for educational purposes. See the needle going in? See the needle going in? So we just did this. This was a training video that I made for some physicians. And I just wanted to show where the needle was. And you could see where the needle was going down to the bone here, the basal joint. And then of course we do the all around the joint, and the typical person for chronic pain needs about 4 visits. There definitely are people that 1 or 2 visits, but typically by the time somebody comes with thumb pain, it's been going on for a really long time. So this is the side and the back of the thumb, so we'll watch this so you could see. The treatment's done very quickly. The injections in the thumb, they do hurt a lot, but I've had, it's interesting, in the course of 30 years of doing prolotherapy and, you know, probably several million injections, I've only had to have my thumb done, you know, praise God, just a few times, but the prolotherapy worked great. So you can imagine how much strengthening of my ligaments had to occur for it to handle the force of me doing, you know, over 1,000 shots or whatever every day, or tens of thousands, hundreds of thousands of shots every year. And prolotherapy just works spectacular for chronic thumb pain.